The first case in the state of Louisiana was here in this hospital. It was Sunday, March 8th. I've got a lady here who has some sort of pneumonia. It's not acting normal. It doesn't look like what we're used to. It's not responding to the treatments that we're used to giving. They decided to test the lady for COVID. The next morning at about 11:30 a.m., we got a phone call from the state saying, we've got a positive. I'm even getting chills just thinking about it because it was such a earth-shattering, world-changing moment. Every day for the next month, everything went away and it was all COVID all the time. All of the testing was going through the state, and the state was kind of figuring out how to handle that. At the very beginning, we had to call them for every test and have, provide justification, and some they agreed to test and some they said, no, we don't think that meets our qualifications. And so we were trying to manage that, and the lab's busy, and so to find somebody to have to call the state every time was crazy. So I became the person who's sort of the go-to person for testing, or the testing czar. Science works. Science is pretty amazing. The thing that I think is hard is that science is not perfect. I know we like to say medicine is a science, but it's really an art. Medicine is an art. You have to be flexible. You have to be willing to recognize that things are not going to always be perfect. But unfortunately, the community doesn't understand how science works, and so everybody gets very worried and begins to distrust the pharmaceutical companies or the physicians or the hospitals. So that's been really challenging to kind of see how the general public doesn't understand science and how that then affects decision making. I think people got upset at the beginning because there were some messaging about not needing masks, and then it shifted to needing masks, and then it shifted to, needing eye protection, and there were various things. But this is kind of what happens. You have a new disease. We don't know anything about it. When we began, we didn't know if it was airborne or droplet or, what the risk was. And then as we kind of begin to get into it, we start making new discoveries and then recommendations based on those, and then something else comes up, and then we change and we shift and we, apply what we learn. This is exactly how things work in my world every day. I have a patient who comes in who is, crashing, needs to be on the ventilator, the whole thing. And then I get a blood culture back and he's growing this bacteria, and I put him on this antibiotic, and then I learn that it's resistant, and then I change the antibiotic. That's the way that we take data, we apply it, we get more data, we apply it, we shift, we change. If we had to be lock stock in one direction all the time, then it would be terrible. So I think the big challenge has been just seeing the reaction of the general public to the way science works, and how, it's hard to both get people to understand that we want them to do what science supports, and we, at the same time, trying to explain how science works,